And that'll bring us to our first guest, who is on the program with me. Dr. Brad Greenberg is calling in from San Juan Regional Medical Center. He's joining me on the phone this morning live. Dr. Greenberg, good morning.
Good morning.
Thank you for being with us. Appreciate your time as always. We were just talking about the mask mandate being lifted in New Mexico, but of course still in effect at the hospital, and of course still in effect in congregate settings and elsewhere. We were looking at some of the case numbers that the state puts on their dashboard from San Juan County about the 7-day rolling average, and of course a steep decline. And so my first question to you, Dr. Greenberg, is we hope we're seeing some of those declines with patient levels, COVID patient levels at the hospital. Are those reflecting what we're seeing for COVID cases?
That's a great question. I think that right now what we're actually seeing is very similar to what we've noted with our past surges, in that the case numbers go up in the community, the percent positivity goes up, but then hospitalizations as well as critical care hospitalizations and deaths, they do lag. And so even as we've been watching those case rates decrease in the community, our rates in the hospital have sort of stayed between, say, 40 and 50 for quite some time now. And just this morning, I was very encouraged that we have just snuck right below 40. So now we are at 39 this morning. And so we are hoping that we follow the similar trends with the rest of those indicators, as you mentioned, and that we'll be able to emerge from the Omicron wave.
Well, that's encouraging news. And I do want to caution the audience. I think we're all encouraged that the mandate has been lifted. Of course, I think it's still given as an option for folks to wear a mask if they feel they would like to do that. There's a lot of choice going on. The schools have said that as well. Let me ask you, Dr. Greenberg, what's your advice? As much as we'd like to be put this all behind us, do we still need to be? We should still be careful, shouldn't we, out in public, or what would you say?
I think this, like we talked about at the very beginning of the pandemic, a lot of this is about making really good choices. And I think that trying to understand who you're going to spend time with and what their risk might be, I think are some pretty good points. I'm very encouraged, just like everyone, about the relaxation of the mask mandate. Of congregate settings and hospitals, of course, we are still going to be masking, as you mentioned already. But I think that if folks could just simply consider, are they going to be hanging out with folks that have perhaps kids less than 5, anyone who's immunocompromised or on immunomodulatory medication, or perhaps the elderly? I think those folks probably deserve ongoing and continued extra measures of caution, because despite the fact that we're all that we'd like to be done with the pandemic is not done with us. It's going to be part of our lives, and that means that as this becomes endemic and not necessarily a pandemic, and it becomes perhaps seasonal, we don't really know. We just need to continue making good choices and using those tools that we know work. So I think this is a moment to be happy about where we are in the context of this surge. And I think we should be asking ourselves, how do I make good choices? How do I make sure that I can do my best and my part to help promote the health and safety of my friends and loved ones? And how can we make the pandemic part of our lives, but not the center of it?
Good advice. Good advice, Dr. Greenberg. I'm getting myself a little bit of a flashback to last July when we had gotten rid of the color-coded map in New Mexico and moving forward and seeming like things were on their way out and celebrating and maybe having a 4th of July celebration. And then we got this variant, and that was Delta, and then we thought that was going away, which it kind of did. And then we have Omicron. And so I'm a little tempered with this celebratory feeling because I'm just wondering what's still out there. And I guess we could still see another variant, couldn't we? And I think there's still some out there bubbling around that are getting the attention of researchers and scientists. And so we still need to be careful, don't we?
Well, I think that this is part of how COVID-19 is going to end up being part of our lives and part of this era. And I think that you're right. I think that future variants are very likely to occur. But I think that the important part is that we don't have to reinvent the wheel. I know we are doing our best at the hospital to make sure that we are learning from all these lessons, that we're integrating all those lessons into our clinical model, and we're doing our best to do that in a way which has as small a footprint as possible, but remains effective. And I think that anyone and everyone out there needs to think about, this is not really going to go away, and it shouldn't be ignored, but it should be integrated into what we are, I would say, integrated into making those good choices. Do the risk assessments, don't ignore the fact that COVID-19 is still around, but let's not make it, the center of all of our decision making. Let's just make sure that we're making good decisions that take it into account. But I do think that things can change, and things have changed. And you're right. Last summer we had somewhat of a nadir in our hospital numbers and the percent positivities, and things did deteriorate over time. And our Delta wave was the worst wave that we had yet. And I think we're all hoping that those kinds of episodes, those kinds of surges, those are behind us. But that's a hope, not a promise. And so we remain prepared. And I think what I would encourage folks to do is to think positively, but to make good choices.
Fair enough. And I think we've all learned a lot over the last 2 years, thanks to folks like you and others who we've been talking to and listening to about the efficacy of well-fitted masks and the vaccine that's now available readily for anyone over age 5, I believe it is now, right? And using those tools as well to manage ourselves and our health, and that would be also the way forward, I guess, through whatever is still ahead that we don't know.
Yeah, I strongly agree with that. We are in a very different place than we were in spring of 2020. We're in a very different place than we were a year ago. We have, really good history now of using COVID-safe practices, but also we have some treatments that help try to keep folks out of the hospital, monoclonal antibody infusion therapy, and there's been considerable research and advancement with the understanding of and the treatment of COVID-19. I will strongly suggest, yet again, that anyone who has not yet been vaccinated, please get vaccinated, because that's the best. That's the best treatment that we've got, is to basically help mitigate the effects of the illness by making sure that you have been vaccinated prior to any sort of exposure. But I agree. I mean, the constellation of COVID-safe practices and the immunity throughout the immunity garnered throughout the entire community puts us in a different place. And hopefully the impacts from any future COVID-19 surges will be mitigated by those experiences.
Very good. Let me shift gears just a bit with you, Dr. Greenberg. As we hopefully see these declining COVID cases and declining deaths and all those things that come along with case numbers going down, the focus may turn to folks suffering from what has been called long COVID, and these are maybe folks who, maybe had a severe case, they were hospitalized, but they recovered and are home, but they still have some lingering effects, and we keep hearing, reports about how this virus affects systems in the body, from lungs to other systems and things along that line. There's some studies out about the old antihistamines that may be helpful in treatment of some long COVID symptoms. I guess question A, have you seen those studies? And question B, what do you think about them?
So indeed, long COVID is becoming, I think, what's been characterized as an evolving or an emerging global health crisis. And so, yeah, I mean, I've seen those studies. I think that we are at the very beginning of our understandings of what's going to happen with long COVID. But I do think it deserves some discussion. I think that, most folks refer to it as long COVID. It's also been called post-acute sequelae of SARS-CoV-2 infection, or PASD. Poorly described disease. It basically talks about things like fatigue, night sweats, fevers, joint pain, body pain, shortness of breath, post-exertional discomfort, chest discomfort, headaches, sort of this brain fog, anxiety or insomnia, or rapid heart rates, food intolerance, different things like diarrhea or bloating, different kinds of rashes. I mean, it is a really broad kind of clinical syndrome that we're just beginning to understand. But here's the numbers that I think are really troubling. 2/3 of patients that are hospitalized with SARS-CoV-2 can develop this syndrome. and up to even folks that weren't hospitalized, like perhaps they think perhaps 11% or more report symptoms 6 months after infection. And so the one that's really been garnering more attention recently is essentially a case report of 2 people that had significant long COVID symptoms and then were put on a structured regimen of antihistamines. So this is a case report. So this is like a story. So when there's lots of different kinds of studies, we take into all these studies into account. But case reports are basically a story about what happened with a couple patients. In this case, 2 patients. So, and it looks like they took structured regimens of H1 and H2 blockers, and they seem to do somewhat better. Both anecdotally as well as with some blood tests associated with it. There have been additional discussions of antihistamines, and those include a study performed in August of 2020, where they talked about a whole range of different evolving therapies relatively early in the pandemic. And then another one more recently, which discussed, actually did a study of and tried to answer some of these questions about antihistamines, which I think deserves a little bit more discussion. And so I think that, there are some key questions that are unanswered. So one, why do these folks go and develop long COVID? And 2, what are the underlying pathological mechanisms for it? And 3, what would reasonable or rational approaches to therapies include? So they did a study here, which included a little bit under 50 patients, which had long COVID, and they did try to use histamine receptor antagonists or antihistamines. And they also did a whole series of different blood tests to begin, and that's I'm going to emphasize, we are at the beginning of the understanding of why long COVID is long COVID. And so they did a matched cohort. So they took these folks that were untreated, and they had full recoveries from COVID-19, and they looked at their symptomatology, and they compared it with those folks who received antihistamine treatment who did have symptoms of long COVID. And then they also did blood tests. Predominantly what the blood tests that they did were, there were T-cell descriptions. And you may be familiar with some of these T-cell names, mostly from descriptions about ongoing therapies and surveillance with things like HIV. And so they measured CD4 and CD8 counts, and they also looked at symptoms. And it did look like there was some marginal improvement in the symptoms. And really, and they also saw significant prolonged T-cell numbers in folks that had long COVID. And they were trying to follow those over time for up to 400 days. And they noted that those numbers stayed high in those folks that had long COVID. And so we are at the beginning. Really what these studies really show is that further detailed clinical studies of the potential benefits of antihistamines and the immunology underlying long COVID are in our near future. And so I think that it's not quite time to hang our hats on a case report with 2 folks. These are relatively benign medications that you can get over the counter. But I think any prescription of antihistamines should be done in the context of work with a primary care physician that looks to see whether or not you can have demonstrable improvement. But I think that this is the beginning, and it's kind of exciting when it comes to science and the scientific understanding of a new clinical entity. And we in medicine are going to do our best to try to find therapies that are not based on anecdote, but they're based on real clinical science, and we're going to try to bring those to patients as soon as possible.
And that's what we've been hearing from folks like yourself for the last 2 years, Dr. Greenberg, is to kind of, watch these studies, follow the science, and as we learn more about this, and I guess that's been maybe the frustrating part for a lot of folks, understandably so, in the country, in the world, because this has just been such a new experience, and science has been trying to work just as fast as they can. The vaccine development is a great example, I think, to try to take what we are learning, and that's evolving every day, it seems, and put together some treatments, put together some vaccines, put together some kind of plan forward to protect as many folks as possible. And it really has been a learning curve and a learning experience for a lot of us. Wouldn't you agree?
I really do. But let's emphasize here the progress and the scientific pace here has just been amazing. Like, let's look at vaccination, that where we had no vaccination, we didn't have a good understanding of what was going on with the virus. Now we have multiple vaccinations that function. We've done ongoing studies. We know of what their effectiveness is. But also there's been multiple studies of different kinds of medications and therapies. We started and we had problems with testing. And now we're talking about broad-based testing you get mailed to your home, testing you send out, rapid testing, PCR testing. And we have market improvement in our understanding of the required personal protective equipment, the effectiveness of COVID-safe practices, monoclonal antibody infusion therapy. I mean, so I think that this is one of these moments where nothing is ever going to be fast as we would like it to be. But also, let's recognize that the scientific process is moving at a pace which I think is really, truly unprecedented. And I think that we just need to continue that work, even if the pandemic becomes not in the forefront of everyone's day-to-day lives. And I hope that that is in our near future. The scientific pace of research, investigation, and interventions that can be developed that are predicated based upon really good scientific evidence, I think that's going to continue to evolve. We're going to get better at this. And so I think that there is much to talk about in the successes of science here. And we're going to continue that work and make sure that we provide the best care for everyone in our community.
Very good. Well, Dr. Greenberg, as always, I appreciate your insights this week, talking to us and our audiences about what has been going on. And we're encouraged by the numbers you report from San Juan Regional Medical Center. We hope they keep going in that direction. And we're hopeful for the rest of our state as well. But we probably won't put you off the hook just yet. We want to keep you on standby for the next program, if you don't mind.
I'm always happy to chat with you all, and I'm always happy to help get the latest and greatest out to our community. And it's always a pleasure. Thank you.